Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Monday, July 28th. I'm Elizabeth Arkalian. Healthcare providers are bracing for changes from the big, beautiful bill.
Those hospitals are anchors in those communities, and we know if you don't have a hospital in some of these rural communities, you're driving 30 to 40 minutes away to receive emergency care.
Could closures be on the horizon for some? We will hear what it all means for our region. That conversation in just a moment.
Support for Central Valley Daily comes from Fresno Mazda, part of the Prieto Automotive family, leading the industry in the IIHS 2025 Top Safety Pick Awards, helping move Mazda closer to the goal of eliminating traffic fatalities. More information in the Mazda digital showroom available at myfresnomazda.com.
And now to our feature story. There are many changes coming down the pike from President Trump's One Big Beautiful Bill Act, which he signed into law on July 4th. The new law is wide-ranging. It stops taxes on tips, raises the country's debt ceiling, and funds the president's Golden Dome missile defense system. But perhaps the most notable change set to impact the lives of Valley residents are those coming to Medicare and Medicaid. The new law cuts billions from the federal health care programs over the next decade, limits eligibility for certain people, and will likely cost more for anyone enrolled. President Trump is touting the changes as a way to strengthen federal health care by eliminating waste, fraud, and abuse. But what does that mean for the millions of people who rely on Medicare and Medicaid, especially those in the Central Valley, which includes a congressional district with some of the highest enrollment in the country? And what about the hospitals tasked with caring for those patients? KVPR's Rachel Livinal went looking for answers about how the big, beautiful bill could impact the Valley healthcare system. You can read that story on KVPR's website. But Rachel joins me now to help us better understand the specific impacts local residents may feel. She starts by sharing some of the programs impacted by the bill.
So the bill pledges to cut social safety resources like food stamps. It also is applying more restrictions to those who are on Medicaid. It's not only cutting funding for the program, but it's also installing new work requirements and more frequent proof of employment. This could make it harder for people to enroll and maintain coverage on it. For hospitals, they are losing some Medicaid reimbursements, which they rely on to continue their services, especially if they serve a large Medicaid-enrolled population. There are different estimates out there, and things still remain to be seen until these changes kick in next year. But for people in the Valley, these changes do have potential to be especially impactful. The Joint Economic Committee in the Senate found that over 240,000 people in the San Joaquin Valley would be left without Medicaid coverage because of the different changes.
And for your reporting, you spoke with different hospitals across the valley and asked how they would be impacted by these changes to Medicaid. Why specifically did you reach out to those hospitals? What prompted you?
Yeah, so there was a report released last month that showed a study done by the Shep Center. It's out of University of North Carolina in Chapel Hill. They did some research that showed dozens of hospitals at risk of closure for Medicaid cuts across the country. In California specifically, the study listed 28 hospitals at risk of closing, and 7 of those were in the San Joaquin Valley. The way the study deemed them at risk was based on whether they were in vulnerable financial positions within the last few years and whether they have a high volume of people on Medicaid, or what, we here in the state call Medi-Cal. Ultimately, that study was included in a letter to the Trump administration by U.S. senators in an effort to show them the potential impact of the changes they were moving forward with.
Do we know where those 7 hospitals are? Were they spread out across the valley or concentrated in a certain part?
They're kind of all across the valley, but mainly they're in very rural areas. So like Coalinga, Reedley, Tehachapi Valley, Los Banos, like all places that are kind of out there.
So you spoke with some hospitals as well. What did they have to say? And have those hospitals on that list responded publicly to that report?
Yeah, so I spoke to networks that represent 3 different hospitals in San Joaquin Valley. It was Tehachapi Valley, Reedley, and Los Banos. Ultimately, they say they're going to do what they can to continue to provide services despite the changes. Here's Kiyoshi Tamano with Adventist Health. He represents hospitals in Reedley and Tehachapi Valley, both hospitals in rural areas.
Those hospitals are anchors in those communities. And we know if you don't have a hospital in some of these rural communities, and they're literally designated in areas like Tehachapi as critical access, you're driving 30 to 40 minutes away to receive emergency care.
Tamano said a lot of times when people don't have health insurance like Medi-Cal, they might only come to the hospital when their situation is dire. So this could clog up the emergency rooms.
They don't see preventative care, and they come to ERs for care because that's where you go if you don't have a primary care doctor or a person that's following you up on a normal basis. And an ER is just not an efficient, way for you to get care because that's not what the ER is intended for.
Tamano did say these are all things the hospital network is thinking about, and they're working with elected leaders to hopefully plug any holes.
How do hospital systems continue to take care of those folks and pay for all those operations and services? That's the challenge I think that people are pondering.
It's certainly a big topic of mind right now. And I know Valley residents are probably familiar with these challenges that hospitals here face. They've probably heard about Madera Community Hospital, which went out of business for a while. I know Kauai Health in Visalia has struggled financially, especially after the pandemic. Could you give us just a brief overview of why, even before this new law, some hospitals have just really struggled in our region?
Yeah, well, based on reporting that KVPR has done in recent years, we know that the San Joaquin Valley has a very fragile healthcare system. People here suffer from chronic health conditions, and there are also environmental challenges like pollution that worsen that. As we know, the Valley also has fewer doctors compared to places like the Bay and LA. It's a health environment where there just isn't a ton of investment, and that's what worries health advocates, that the problems will only get worse.
And given some of those issues, would you say that healthcare is top of mind for some of our local elected officials?
What I understand from elected officials, especially at the congressional level, is that they are at least trying to look at solutions. I know Adam Gray and Merced and Jim Costa, both Democrats, have worked together on legislation to improve medical education in the Valley. They're hoping to produce more doctors who could live and work here. David Valadao and Vince Fong, who are Republicans, also have pushed for funding solutions, but perhaps in different ways. They both have touted what's called the Rural Health Transformation Fund, which did secure $50 billion in funding in the Big Beautiful Bill.
Okay, so speaking of the Big Beautiful Bill again, how did those electeds vote? Did they express concerns? How did that sort of shake out?
Yeah, of the 4 congressional leaders in the Valley, the 2 Democrats, Gray and Costa, voted against it. Both Fong and Valadao voted for it. Gray and Costa both expressed concerns with the passage of the bill, saying it threatens an already fragile hospital care system. Meanwhile, as I mentioned, Valadao and Fong said they made sure to include more funding in a rural hospital program that they said would offset the loss in funding to rural hospitals. The Valley is considered a largely rural region of the state, so those funds could benefit here. The program is aimed at expanding rural healthcare access across the Central Valley. It will disperse $10 billion each year over the next 5 years, equally to states. The goal of the money is to improve telehealth services and fill financial gaps for rural hospitals. Hospital leaders have also said they've been speaking with legislators as they move forward, so we'll see how they continue to help.
Okay, Rachel, I was actually surprised to read in your reporting that Governor Newsom actually said Congressman Valadao should be voted out of office for his support of the Big Beautiful Bill. So can you give us some background on why that's significant?
Valadeo represents House District 22 in Congress. That district actually has the highest enrollment in Medicaid in the country, according to a New York Times analysis. The Times found 68% of residents in Valadeo's district are enrolled in the healthcare program. So you can imagine that Valadeo has the spotlight in this debate, and I think the governor took the opportunity to keep it there. Especially with looming midterm elections next year, campaigns are already starting against Valadeo precisely around his support for the big bill.
Yeah, I think several Democrats have already thrown their hat in the ring sort of in response to his vote. All right, so we've given an overview of what could be next for some of these hospitals. What do we expect to start seeing the effects of the Big Beautiful Bill Act?
Well, generally, changes to policies in the bill that have to do with taxes and such, some of those are taking effect immediately. The earliest some changes in Medicaid and things like SNAP can take effect is as soon as this year, but funding reductions for Medicaid are set to kick in starting in 2026, and work requirements for Medicaid will kick in 2027.
KVPR reporter Rachel Livinal, always great to chat, and thank you for this reporting.
Thanks for having me, Liz.
And you can read Rachel's full report titled What the Big Beautiful Bill Could Mean for Some Hospitals in the San Joaquin Valley on the KVPR website. KVPR has also reached out to Representatives David Valadeo and Vince Vong several times for an interview to discuss the One Big Beautiful Bill and changes to Medicaid and other topics. So far, they have not been made available for interviews. And that is today's show. If you enjoyed listening to Central Valley Daily, please help support the podcast by leaving a 5-star rating in your podcast app. And you can always share the podcast with a friend. That helps too. Today's episode was produced by Jonathan Linden, Rachel Livinal, and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. You can find the latest local news anytime at kvpr.org.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.